What's the point of being angry? If you were in the right place, perhaps he would have lived. Even if he was born and had died later, we would have thought it was his fate. From here to here, they cut off tiny pieces and pulled him out with forceps.
15 years ago, Indra Maya lost her first baby. For 3 days, she had intense labour pain. There were no doctors available, and the baby died inside her womb. It had to be surgically removed.
They must have gone to play. If they are not back soon, they must have gone to play. The younger one must have gone to play with a friend. I wonder when she'll be back.
Even though Indra Maya has come to terms with the loss, she still suffers from anxiety over her 2 other children. But Indra Maya was lucky to survive. Nepal still has one of the highest maternal mortality rates in the world, with as many as 5 out of every 200 women dying in childbirth. And the figures could well be higher. Studies show that 15% of all pregnant women throughout the world are likely to develop birth complications. Without emergency obstetric care, these women could die. Only last year, an estimated 10,600 women would have needed emergency obstetric care in just 4 out of Nepal's 75 districts. Only 452 of these women were seen by the hospitals. Nobody knows what happened to the other women. Many may have suffered permanent injury and become socially ostracized. Probabilities are, most of them did not even survive. In remote areas such as these, women are often not accounted for. They simply disappear. After years of unfulfilled promises from the government, a new doctor has finally arrived at the district hospital. Dr. Gunraj Lohani has brought with him a new determination to bring change to an ailing health system. For years, the lack of roads has kept most development and distribution of services away, and the brain drain to the cities has led to an acute shortage of professionals, especially doctors and nurses. With the doctor's arrival, things look set to change. It has just been 2 weeks since Dr. Lohani trudged 8 hours up the long misty trail that links the nearest airport to Diktel. Since his arrival, the number of outpatients has increased from 30 to over 100 patients per day. For the women in Khotang, Dr. Lohani's arrival is particularly important. He is an MD GP, a medical doctor in general practice, and is capable of dealing with emergency obstetric cases. But in the labour room, things are not going well for Rudra Kumari.
Don't panic. Try and walk properly. Listen, love, don't start pushing. It's not time yet. The baby is not going to fall out right now.
Rudra Kumari had complications